Do you have any questions?
So is Danielle Thomas, is she going to be taking Mr. Lundy's seat? She's going to be
She
serving in
is.
that seat instead of.
She is, and the only reason she's not here today is she's at a conference in DC. But yeah, she would take his role, so they wouldn't have two roles.
Got it. That totally makes sense.
Motion to approve.
Second.
Any further discussion? Hearing or seeing none, all in favor, signify by saying aye.
Aye.
Any opposed, signify by saying nay. Hearing no nays, motion passes unanimously. All right, moving right along. We have a special guest in the house. We have Ms. Errol Woodard from the city of Largo, and she's gonna, we talked about this at the last board meeting. She's gonna present on a safe harbor report.
We actually have a team.
Oh, we have a
So
team.
Susan Ferrand, just have Lieutenant Page.
Also known as the Musketeers.
Yes. Of the safe harbor worker. I think there's a PowerPoint, right? While she's getting it loaded, I'll just kind of give you a little overview. So almost a year ago, the mayor of the city of Largo had requested a meeting with Pinellas County, the sheriff, and the CEO of Homeless Leadership Alliance to discuss some of the impacts that the community has had, both in terms of high EMS calls at Safe Harbor, as well as the cyclical nature that each day, you know, it fills up and as our biggest homeless shelter in the county, and then filters out into the High Point community each morning, to look to see if there's more proactive approaches and better solutions versus just triaging and putting that Band-Aid on, you know, on it all the time. So we were asked, we have a homeless task team within the city of Largo that's made up of staff kind of on that ground level. And so we were asked to kind of spearhead that work group. And we pulled together Susan Finlaw, the SOSERF on it, Lieutenant Hayes. We had a few others from our budget office that participated, as well as the lieutenant from the fire station that serves Safe Harbor, and a representative from our problem-oriented policing team on there as well from our police department. So we've been meeting and we have.
Can I ask one question, just because we have new people in the room? So you just said something that I just want to ask Lieutenant Hayes, because I'm hearing, because this is an important distinction. So Era just said our largest homeless shelter. It's my understanding that Safe Harbor is jail diversion. Are we now identifying Safe Harbor as our largest homeless shelter, or is it a jail diversion program that serves the homeless?
So we focus it as a jail diversion shelter that serves the homeless. But we're also 45% of the adult beds available in Dallas County. We're the only 24/7 shelter.
Okay, I understand that, but it is a jail diversion program that serves the homeless, as opposed to it is a homeless shelter.
It's a jail diversion shelter. We don't have a program necessarily, so it would be a jail diversion shelter.
Okay. We just have new people in the room. It's important that we understand this was set up by our sheriff as a jail diversion shelter, and not as a homeless shelter, or the largest homeless shelter. It functions that way. I get that, but it is a jail diversion shelter, and that's the way it's staffed. That's the way it's funded. It is not funded as a homeless shelter.
So if you go through the attachment that was sent out, I think last night or the day before, it kind of spells out exactly the purpose of Safe Harbor and where it came from, and a little bit of historical information on why we got here. We just didn't want to get into the weeds of this and spend more time discussing that facet and get kind of right into the findings and the goals and recommendations.
Yeah, there is a lot of information and there was a lot of startup with that there's people that were having minor nuisance ordinance violations, public urination, public drunkenness, and things like that were ending up going to the jail system because there was no other place to take them. They're the only 24/7 shelter in the county that people can go any time of day or night to stay there.
Right, but that to April's point, is some of us were very there at the beginning, is this was specifically, instead of these people getting arrested, it was a jail diversion program. It was never, like, from its initial intent, it was a jail diversion program versus a strict homeless shelter. And And I do think that April's correct in saying that that's important, because from there, a lot of investment has come from different cities and everything else, that it's become somewhat more of a shelter. Because I imagine you're going to talk a bit about how, you know, you have people who aren't coming only strictly as diversion. So,
Yes,
okay.
yes, yes, and actually, the majority of clients now, to my understanding, I don't have the data offhand, but it is in the report about how many are brought either from the jail over there or brought from law enforcement, but it is a smaller portion of the population at this point. But to that extent, these are the volume of people that stay there and that cyclical nature has created some of the issues that we're seeing, where there's not an end solution to homelessness for the majority at this point, and it's just revolving. So this is why we're asked to look at this and see how we could potentially make some modifications to get those better outcomes while we have this congregate group of homeless individuals in one place to really focus on getting them housed. So Susan's just going to touch on some of the findings, and this first one is just a little bit to give you a status overall in the system, not the safe harbor. And then Lieutenant Hmis and I are going to cover some of our recommendations that are in the
Okay, just to offer some context, there's 101 individuals that are enrolled in a rapid rehousing or home supporting housing program that are currently awaiting housing. There's additional 267 individuals that are awaiting access to PSH, and 839 individuals are awaiting access to rapid rehousing. This slide shows the average acuity score, median days of facility, and percentage placed in housing for all of the shelters. Excuse me. So the serving individual. So you will see that clients at other shelters have similar acuity scores, but they're staying longer. And excuse me, we need to keep people at the shelter long enough to be assisted and have sufficient services.
So I just want to mention for anybody who saw this at the Largo meeting last week, this week, all the days run together. Initially, St. Vincent de Paul wasn't on here, and there was a lot of conversation about, you know, there's a low barrier shelter, and so we shouldn't expect too much in outcomes based on the type of clientele they're serving. And I asked that we add St. Vincent de Paul because they are also a low barrier shelter, and it is the best apples to apples comparison that we could have. I was a little surprised to see that St. Vincent de Paul's acuity was lower than HEP. But you can see the difference in the housing outcomes with, you know, those two programs, for example. And you can also see, as Susan just mentioned, that the median days in the facility do make a difference. And I think it was interesting, you know, to April's point about the jail diversion piece. I think it was Mary and I from Largo were talking about, if it's a jail diversion program, 2 days is what somebody would want to stay in that type of facility versus, you know, something else. So
I will add that what we figure out, like 11,000 entries during the last year.
Yeah.
So they go in and out, in and out, in and out, so.
Yeah, that median days of the facility is kind of open to interpretation number of people, like Susan said, we did over 11,000 check-ins last year. And we usually, non-COVID time, we're over 13,000 check-ins. So people stay for a few days, they disappear, they go stay in a friend's house, and then they come back. Because if I had somewhere else to stay, I would stay at Safe Harbor, and I'm in a charter for over 8 years.
Well, with the 11,000 check-ins, how many of those are unique clients? I would imagine.
We do about 5,000 unique clients a year, so the homeless population sees about 3,000 in the PIC count every year, and we see 5,000 different people.
Okay.
So one thing we did go ahead since the last presentation and add the St. Vincent de Paul data on here. However, the volume of clients served was more around 100. So it is a much smaller population that they're working with. And that is one of the parts of our recommendation is this, you know, this queue and the amount of staffing that's trying to triage 11,000 people. So we really felt like, you know, how do we make it a place where they can come and actually get services and work toward housing. Versus just putting barriers up and say, okay, we're gonna put these walls on this and you have to, meet these criteria to be part of that program, because we really felt that's just gonna push people to stay out on the streets with the population that's served. So finding ways, if you have to meet with a case manager in so many hours or, within 3 days or whatnot, that's available, that you actually will get that chance to do that and work with that case manager. And how do we make sure that you have those resources there to actually get you moving toward housing?
And I would add one more thing, that we think during the SWOT analysis, we do think that there's a higher permanent placement from Safe Harbor. They just don't have the capability to track that, and HMIS will follow up, so we do think that that percentage is higher. But just because of the staffing pattern, they don't have that.
Next slide, please. All right, so we have seen a decline at the shelter as well. This has trended over the years. They're seeing it now. Even, I know during the pandemic, they reduced the amount of beds available, but even since they've opened back up, I think it's about 270, 275 max on a night right now. The capacity is 470. So it's far down from its capacity. So again,
Well, I just wanted to add one more thing, that the 2022 data indicated a decrease too, but I think you were having an outbreak of COVID then. So,
Yes.
yeah, so that, take that,
Yeah.
with a grain of salt. So.
So one of the parts to this too, we've heard from our street outreach officers that people are just refusing to go for a variety of reasons too. And so that also leads into, well, if we want to help them get in housing, first we have to figure out what the barrier is, why they don't want to go. So we have full shelters, and then we have a place that has beds, but they're choosing to stay out on the street instead. So our recommendation is saying that. So the data shows that about 15 to 20% of the people that go to Safe Harbor are chronically homeless. So the majority are those that could probably be served with rapid rehousing, potentially even self-resolved through some diversion and so forth as well. I don't know if you all have discussed Built for Zero at all.
It's the next board meeting.
Okay,
sole
okay.
topic, but
So national approach to ending homelessness is called Built for Zero, and it's where you really target in on a specific homeless population, and you really take that individualized approach. So you can't just put a blanket and say, we're going to fix everyone's homelessness by doing this. It really is looking at, Joe Smith's got, these medical conditions and needs, mental health counseling and this, that, and the other. So if we're going to get him stabilized, what resources need to come together to get him not only housed, but keep him housed? And so that's really that approach that we're recommending as part of addressing the population.
Eric, can I mention something here? So earlier this week, we had a task force look at street outreach. There were a number of street outreach officers, as well as directions and the county and others came together for that discussion. And I just really want to highlight this point that Era is making about this one-size-fits-all solution. One of the things that we heard officers say, or we hear it in rooms every day. We heard it in the room when the Safe Harbor report was presented the first time, is they don't want help. They don't want help. And I think what we're missing is understanding the rest of the sentence, which is they don't want the type of help that we're offering. And we have to figure out what it is that people need and want and meet them where they're at. And yes, they don't want to go to Safe Harbor. Zach just said he wouldn't go to Safe Harbor after 8 years, right? But we need to figure out what that thing is. And so one of the things that I know they're doing in Largo that I would suggest we add to HMIS and make a standardized question is, when people refuse shelter, why are they refusing shelter? If it's because they need their pets, then we need a program for pets. If it's because they have a family unit that isn't defined as a family unit, we need to be able to program for that. And so I think, I just really want to underscore this idea that there isn't a one-size-fits-all solution. And when we're people-centered, we meet people where they are and find out what it is they need, not what we're offering. And I feel like that was a big takeaway from the street outreach conversation as well.
Yeah, I've been doing this a long time. I mean, and so my memory might be creating stuff, creating my wishes or whatever. But I'm saying, I remember, when the sheriff, was first proposing this, and I was vehemently against it because I thought that, it was, it's like akin to criminalization and putting people out there in the jail or the former jail or next door to the jail, okay, was actually opening to the door to letting the police be social workers and letting the police decide, make decisions in a meritocracy. Okay, and so homelessness to me still is, and that's one of the problems is a meritocracy. Who deserves? And you have to be honest and struggle and go deep in your heart to say deserves got nothing to do with it. 4 walls and a roof. 4 walls and a roof. Everybody deserves that. Okay, but we went out to San Antonio, Texas, to look at a program. That's when what's that guy?
Marvin.
Yeah, with Marvin. We went out there to San Antonio, Texas, to see the program that they had. Several representatives from Safe Harbor went with us. Okay, and so these representatives were social workers. They were teachers. They were people who were poised to it's like when people got into Safe Harbor, they were the next level, and it's like they did casework, case management, case study, and so you're telling me that none of this is being done now.
There is some. It started with 8 case managers and they're down to 4 because grant funding's gone away. So they have a 1-to-80 ratio at Safe Harbor, which is completely unmanageable.
Okay, so
But GW, I want to cut you off because I want you to remember one thing about this. And I didn't go to San Antonio. I went out and visited the LA Dream Center and then the St. Vincent de Paul campus in San Diego. And what all 3 of those had from the onset was tens of millions of dollars in funding and endowments. And what we did with Safe Harbor, we didn't have any of that.
Right.
So because we had case managers there at the beginning. And it was always, here's the best we can do with no resources committed to it. And I think that it's not fair to the sheriff's office to say this is an apples to apples comparison. Because
well, Mike, forget apples to apples. I'm just saying, has our intent changed? I mean, has the fact that we don't have Hollywood money or LA money or whatever, has that changed our intent? And so I want to go back to the genesis and look at the intent of Safe Harbor. And did it work at all? Is it still working? And see, because ain't nobody getting out. And so probably because of all these damn developers were and that's a 7-hour conversation for another day. But I'm just saying, the intent was when we went there to look at that program, okay, and Safe Harbor was really driving the bus, and so he was like, and I struggle with Republicans anyway, but the sheriff, I found out he was a lawyer, he's a smart man, he's a compassionate man, okay, and so it's like I came on board with him because the intent, because of the level of expertise that was there, okay, I said, well, we might get some people out of homelessness. And so now it seems that it's the biggest shelter in,
So
I respond to some of this stuff?
Sure, you can.
Real quick, because I want to be respectful of the presentation, and we're gonna have recommendations at the end. And I believe we're gonna get into a deeper conversation. I know as this board tends to do, is jump 2 steps ahead of where we're going. But let's get through this presentation, and then I'm sure we'll have recommendations, we'll have findings, and we can talk about all of this. I want to make sure we get through it, and we're not stopping every other slide, so we can have time at the end to discuss this fully, and I will give you some time to respond. Let's just get through the presentation
No problem,
first.
no problem. So one of the other things, as we said, we were tasked at looking at the high volume of calls for EMS services out of this location. We did find that the nature of calls could be things that do require EMS to come, whether or not they know the keywords or are truly having those conditions. Is probably a combination of both. But we had talked about in our report, looking at making sure that the Bayside Clinic hours right next door align better for those peak times when the EMS calls are coming in. When we presented to the sheriff and the Largo's mayor the other day, it came up with an option for potentially putting a pilot program with an ARNP on site for maybe a 90-day period to see if that helps, where they had someone higher skill level medically that could try and triage some of those calls and see if that was an option that would work as well. The EMS calls have been declining lately, and I haven't been able to compare it yet to your population intake too, to see if it's correlates or if it's a further decline. We also found, so Safe Harbor holds an annual neighborhood cleanup event in High Point every year, and they get 100 volunteers willing to come out, willing to go help clean up during the day. And we really thought that was a great example of giving them a sense of purpose, and they respond really well. They have a lunch throughout the day and things like that, but they feel good. They're able to help their community do something about it. And so we also saw that as an opportunity for how do we expand upon that to really build that sense of purpose back up and help them get back on their feet. Next one. So Lieutenant Hayes is going to cover the first 2 goals with the recommendations. I'll cover the last.
So just for clarity, so that everybody understands, the nature of Safe Harbor and what April and Mike were talking about earlier is that the intent of Safe Harbor has not changed. The resources available have changed and diminished. Before that, Directs for Living had a multitude of case managers out there that were funded from a different source. That funding went away, so we lost that. PERT, same category, same thing. So now the sheriff's office is still spending over $2 million a year. I don't know any other sheriffs or chiefs of police in the country that are funding the sheriff's office, that are funding a homeless program in a shelter to keep more than hundreds of people off the street every night. So the intent and the spirit has never changed. We're just having to do the same amount with the same amount of population and less resources and case managers to do it with. We're feeling the same impact that the rest of the nation is we don't have affordable housing to put these people in. So I'm with you, GW, that we don't have anywhere to place these people. It's tough right now. We're seeing them longer and longer and longer. We don't have anywhere to place them. So that's why this committee got together. That's why we convened to see what we can do different, because we can always get better. So Safe Harbor was housing first before housing first was a thing in this community. We're low barrier. Come in. So we want to keep that approach and making sure that we're working towards stabilization and not necessarily working on people getting clean. We got to get them stabilized. Clean's not, always a possibility. So we got to meet them, like Amy said, where they're at. One way to do that is increase the ratio of case managers. Like Aaron and Susan said, we're running it with 81 right now. So we've got to increase the amount of case managers so we can have those positive touches. And when we have those touches, we can make them meaningful. Continue to expand the trauma-informed care training for on-site staff, including staff and entry points, all of our social workers, all of our case managers. Everybody's got that trauma-informed care, and the HLA puts it on for free still, correct? Mm-hmm. Yep. So evaluating building improvements for trauma-informed design to overcome willingness to street homelessness. We walk a fine line. We have a facility. It's got 4 walls. It's got a roof. It's got AC, which is really necessary in Florida. It's got everything you can need. But can we look at the building? Can we do different things to make it a little bit more pleasant? To make it more a little bit keep people wanting to come and keep people wanting to stay.
And I just want to touch on that real quick. That ties into the people, some other comments that we've heard from people staying on the street of why they won't go, whether it's a safety thing or sometimes it's whatever crisis they've been through before that makes them feel unsafe there, and really finding out what those are through looking at the design of the building to see if there's ways to actually make them feel more comfortable being there and safer to
No, it's tough, because if you walk in there and you want it to look like an institutional setting, it will look like an institutional setting. If you want it to look like an opportunity, it can be an opportunity, and it'll look like an opportunity. But maybe we can do things to soften the image and make it look like more of an opportunity. Invest in permanent supportive housing, affordable housing stock access, and access to housing. That's where you all come in, this is above our pay grade, but we recognize. Adding a rapid rehousing team out there. So rapid rehousing has rapidly rehoused, I think, 8 adults in the last 2 years out of Safe Harbor. And I'm pretty sure that half of those were veterans through the different assistance programs for the veterans.
but there's not an actual team there.
There's not an actual team, so the idea is we put a rapid rehousing team out there. Maybe we can have those on-site touches, because the population that we deal with that has significant mental health substance abuse issues, they do what they want to do, and they disappear during the day, they come back when they need to get shelter, they come back when they need to get food. So when the rapid rehousing people are calling them or calling our case managers looking for them, they're not always around. So if we have the team out there on site, maybe we can put more touches on. Establish wraparound support services that can be utilized when clients placed in permanent supportive housing. Susan touched on that. We have a lot of more positive exits than is reflected in the data, and we know that. But we don't have the capability to follow up on that case management. We run an 881 caseload. We got to put out the fires that are in front of us. So with an 81 caseload, we don't have time to call around and find out where Jimmy went or where Johnny went and why they didn't come back. They save up 2 or 3 paychecks, they find a room to rent, they don't come back for their bag, and they put Safe Harbor behind them. We're happy for that. But we also can't code that as a positive exit, because we just don't have the resources to climb after the 11,000 people that exit our facility every year that we didn't know about. So if we can wrap around support services and keep in touch with them once they go into housing, we can check up on them and make sure that they're doing things that they need to do to stay housed. Maybe they don't have to come back in through the front door to Safe Harbor or any of the other shelters. Invest in improved connection to workforce training and bolster your income and sense of purpose. So we have our community cleanup every year, and then you guys saw that there's an 80% ratio of the population that is not yet chronically homeless. Let's get them engaged. Let's get them a permanent job. Let's get them some sort of stability. So improving coordination between Largo, Pinellas Park Street Outreach and the Sheriff's Office. We've got a good unit. Pinellas Safe Harbor has a community policing unit that works in the High Point area and is responsible for all the homeless related issues that happen in that area. So in the jurisdictions, we got Largo, Clearwater, and Pinellas Park all within walking distance of that. So we work together, and we will continue to work together and have meetings as needed. But we've got a good communication stream right now between those agencies to make sure that the homeless population that you see on the street and in and around Safe Harbor is being addressed by all these units effectively. And then the countywide strategic planning session was held Wednesday. Somebody that was there talking about that.
So that's for further discussion later on, but yeah, so there is a bigger push, I would say countywide, to work on how we continue to collaborate. Street outreach, especially, we know that someone that's homeless may not stay in the same jurisdiction all the time. So how do we handle that when someone's now in a different jurisdiction, and make sure that shared data and information and those touches and background really is that consistent message too with that individual. So the last goal was on reducing calls to Safe Harbor for emergency services to improve access to other resources. So the county is working on rolling out some fairly sizable mental health and substance abuse programs. In addition to what's there, they're adding components for that at Bayside Clinic, and they're also rolling out a whole mobile medical team that's going to be helping to deploy throughout the community. So some of this is in process, and it actually was happening at the same time, so it kind of aligned well with some of these items. The PSTA Flamingo Fair, we find too that sometimes it's an EMS call. They choose the St. Pete Hospital, and then they're down in St. Pete. but there's probably other ways that they can get there as well. So we talked about incentivizing those case manager visits. You know, each time you meet with your case manager, we'll make sure we can refill your flamingo fares. If you need to go to your job or visit a friend or whatever, you've got that ability to do so, or even to be able to get back to Safe Harbor if you need. As I mentioned earlier, the pilot for the ARNP came up after our report was done. So that is one of those other things that came up, and that might be an alternate for shifting the Bayside clinic hours. When we met the other week with the different HLA in the county and the sheriff, it turns out the Bayside clinic, I guess, has more expanded hours than pretty much any other community clinic of that nature in the country. So that may not be an option to expand those hours at this time, but potentially looking to have something on site might be a better alternative. And then to the gentleman's point about the corridor improvements, we have the jail, the courthouse, the alternative high school, and Safe Harbor on this big expansive corridor that really shows no means of hope we're getting to a better place along there. And it's also very unsafe. You know, we have a huge pedestrian traffic volume from those facilities in that area. There's not big crosswalks across to the different bus stops and so forth. And so thinking about kind of longer term too, community investments, there's a charter school out of New York City that they've expanded beyond their walls of their school to spread hope kind of throughout the whole neighborhood. So those kids walking to school, they see the mural that's a message of hope versus just, rundown buildings or something like that too. And so thinking about how we can integrate that potentially, at least in that Safe Harbor setting. I think that talked a little bit about whether it's an institutional or a more inviting setting, but how do we really instill that sense of hope that you can get to a better place than where you might be at that moment, as well as improving pedestrian safety in that cover. And then the other thing we've talked about specifically is some of the hospitals that a lot of staff have a high volume that return to Safe Harbor after hospitalization are not tied into any sort of quality discharge policy or coordinated care once they leave the hospital if they are homeless. So that is another one of those components that we saw as, when we've got people literally showing up with IVs at Safe Harbor, they're not equipped to handle that. And so that's another component where they're just, EMS comes back out again and then the cycle starts over. So those were the big things. Our next step after this is to bring the report to Funders Council and see if we can pull together an ad hoc group that can just look at identifying potential funding sources for the recommendations in the report. As I said, some of them are already in process. I know the county's working actually with PART on another big employment grant for people exiting the jail system. And then some of the other programs are already out there. So some of it will probably be a realignment or how can we connect the people at Safe Harbor to those services better. And then for things like the additional case management and rapid rehousing teams, those obviously we have to look and see what new funding sources come along.
I know that the sheriff did say that during the last presentation that focus on more case management and that cloud of the ARP would be a really great place. So that was the ARP would be there during non-baseline clinic hours.
Questions, comments? We'll go April and Sam.
I'm going to try to be very respectful of time and how much we've allocated to this conversation. I quite frankly think an entire board meeting should be allocated to this conversation. My issue around Safe Harbor. First, I want to just say publicly, right? I love Lieutenant Haish. I love our sheriff. I do think that, the investment, right, was amazing and necessary. However, it was jail diversion. It was not set up. All of these things that we've just heard as recommendations, I would not support. I'm just going to say straight up, I would not support as a part of jail diversion. Where I would support it is if it was a homeless shelter. which would mean that it would not be run by the sheriff's department, right? I think some of these issues, around trauma-informed care, it's really hard to provide trauma-informed care when you got weapons attached to you. And so what I've heard, right, that the sheriff has said time and time again is that he runs this because nobody else will in the homeless community. I don't know that that's still true. And I certainly don't know if that's true if the sheriff would continue to invest. So I think the issue was historically that nobody else would because there wasn't a financial investment to do it. So the question is that if the sheriff would continue to invest the $2 million+ in addition to some of the supports, and I don't know if that's included in the $2 million or not, but things like all the meals, which are incredible, which are very, very good, by the way, and all that kind of stuff would, if the sheriff said, I will continue to invest the $2 million plus I will give the building plus I'll continue to provide the supports. If a homeless provider, shelter provider would operate Safe Harbor, I think we could go a long way to getting some of these recommendations then fulfilled. So it was mentioned, by the way, I feel something about the fact that we had this meeting and Directions for Living, who is the sole street outreach provider for the entire Pinellas County, wasn't there, right? So I wasn't there for this meeting. And I would have a lot of input in some of the things that my staff hear, see, experience, all those kinds of things. In any case, I think back to, Directions for Living, I can't speak to PERC, but Directions for Living had case management out there. And we did, and our funding source changed. And therefore our case managers, right, couldn't be out there. One of the things that changed the funding source though, is that we couldn't get aligned on, it was jail diversion. So my homeless services case managers, which are federally required, right, around homeless services, having them embedded in a jail diversion program became the issue. And so it is those kinds of things that getting funding sources aligned can sometimes happen pretty quickly, depending on what we're calling something, right? So if we're calling it a jail diversion program, it gets hard to align homeless services funds with jail diversion. Whereas, which is why I always go back to, so what is it? Can we publicly say, right? Can we publicly say that it is in fact a homeless shelter? And if we can say that it's a homeless shelter, there's probably a lot of funding sources that could be aligned with a homeless shelter. So I just think that some of these recommendations, all of these recommendations, make perfect sense for a homeless shelter. Do all of them make perfect sense when it's jail diversion? And I personally think that we call it jail diversion because of the funding, right? That's the way our sheriff, I think, supports, right, his investment. And that maybe, and I don't know this for sure, you may know this, that in order for him to support his investment, that he would have a harder time supporting his investment if he called it a homeless shelter. And I don't know if that's true or not.
So because of the needs of the community, it evolved from a jail diversion shelter into an emergency shelter with jail diversion component to it. We still do the same things. We still have the same levels of jail diversion by non-criminal, by taking charges and converting them and making them essentially go away. That people would normally spend 2 or 3 trips to jail on because they're not paying a ticket when they get arrested. They're not following through on paying the fine after they get out of jail. They're not showing up for a court date. So every time they don't do one of those steps, it's a rearrest based off a warrant issued by a judge. So we've cut that whole chain out. So we have become an emergency shelter with a jail diversion component to it. Call it what you want, but I don't want to speak for the sheriff, and I know Colonel Terry's on, but last Thursday, when we met, the sheriff essentially said that the keys are on the table. I'm still going to fund, we're still doing this. but the keys have been on the table since day one. But our agency is the one that took the bull by the horns and said, all right, we've got access to this building, the county says we can do it, let's open it up, and we run what we run, and directions came in and PERC came in, and now we've got West Care and the HLA's got the version navigator out there, and we're meeting the needs of the community with the, as a front door, as best we can with the resources that we have. Could we do things differently? Yeah, and that's why this whole group met, and that's why we're sitting having this discussion.
Just, one thing is, that did come up the other week on the presentation too, and that's probably above us for a decision on how that would change over. But strongly consider the fact that this is the only shelter in the county that people can go to 24/7. And that is a huge barrier with street outreach right now. If there's one day a week at a certain time, and this person's ready to go to shelter, and you gotta wait till next Tuesday, and then hope you can find them again. And so whatever the change is, I think, make sure we consider that how would that affect, if it changed over, would that change that intake in that?
Oh,
area?
absolutely. It is the only, in my opinion, the only true low barrier shelter in Pinellas County. And I sing the praises about that. It is truly set up to be very low barrier, housing first, the whole thing. So absolutely, that should not ever change. But I do think that how we define what this is important to getting our way forward to these recommendations.
I want to get Sam.
Thanks. So first, I really enjoyed seeing this report in the packet. Thank you all for a lot of hard work that went into this. I love that you all are looking at the connections to other agencies. That's obviously been a part of the success from the beginning, bringing in other agencies to do what need to be done instead of the sheriff's office trying to invent things on your end. You guys do a great job with that, and I'm so grateful for it. I think I'm curious, and this may need some more technical consultation, but jail diversion is obviously a function that building has to serve for it to financially make sense for the sheriff's office. Is that a legal category, or is that a functional description?
That would be a functional description.
So there's no reason you couldn't have it serve some of the jail diversion functions and license it as a homeless shelter and meet those other criteria if that changed in April, I totally get your point in terms of there are some intrinsic barriers that come with law enforcement running a program. I think there's some intrinsic benefits that come from law enforcement running a program, but I think if we have the legal categories on the table in terms of what funding's available for what is impermissible doing something else, sort of put that matrix together and talk about what the right structure is.
I think he had GW next and then you, Michael.
Yeah.
Lieutenant, I apologize, I probably should know this, but, my disease slowed me down a step, and so I'm not as on things as I was. Is there still a component where people are released from prison to go to, and they go directly to safe harbor?
So the component, the MOU that we used to have with the Florida Department of Corrections is dissolved, and they were not interested in renewing it. But that component is still there. We still get people dropped off every day from prison with nowhere else to go. And we have over 100 people a month walk out of Pinellas County Jail with nowhere else to go. They walk back into safe harbor, or to safe harbor first.
Say that last one again.
There's over 100 people that walk out of the county jail every month and walk back to safe harbor or show up there for the first time.
And people that come from the deal.
Yeah, that's not, I don't have good statistics on that because a lot of times they don't tell us. We find it out a couple of weeks later that, oh yeah, I got out of prison 2 weeks ago.
So a couple comments, and I actually have questions. Because first of all, those portals of entry, that was the sheriff, we worked on that with the department, and us and the sheriff's office worked on that with the department. Us, the county and the sheriffs worked on that with the department. And then the department just decided to do away with it. So it was never something that we weren't willing to do, just on the portals. And I want to clarify 2 things. First of all, I appreciate this sort of ode to PERC and our role in it. We were involved for maybe less than a year, so I don't want to overstate what PERC did there. We just happened to be at the beginning, the right place at the right time. And the grant you just mentioned, we're supposed to serve 35 people a year. This is for the really high utilizers, so there'll be an impact, but it won't be that dramatic. So I don't want to overstate that either. My question is, because I really think what April is getting to, and maybe Sam as well, we have to really, this is the opportunity to really define what it is, because there is funding, right? And figuring out how to go that, because my first question was, don't you guys have a grant? I know you have a grant management department. Do they spend time as a sheriff's office going after grants specific to Safe Harbor? Or is it to everything else to do with the sheriff's office, which is enormous? But I do think that from that standpoint, you know, I listen, he was the chief deputy, I think, when we first did this, and he came to us and said, would you guys be interested in running this? Because we do housing. I'm like, listen, because I was a part of the team that opened whatever we called it way back then when it was still part of the jail. You know, it was the bus depot, and it's, you know, 72 beds to a unit at that point. I mean, it wasn't the kind of housing we do. So I don't think the sheriff wanted to take this on. He took it on. And I'm glad to hear he's willing to have the keys at the table, like you say, Zach, because I think there are agencies here who might have an interest in, let's look at this broader. Let's look at the San Antonio models and the other models that we didn't model this around because we didn't have the funding, but was kind of the sort of the acorn of here's what we could potentially do. And it's grown in certain ways, and then it's sort of stalled in certain ways. But I do think that that is an opportunity now to say, look, here's what you guys found. Here's, you know, and here are recommendations. And maybe that recommendation is put it out to bid, you know, and that we take a different approach. I mean, putting it out to bid is probably a little too passe. But those would be my two questions is, how much time does the grant management department at the sheriff's office spend going after grants specific to Safe Harbor? And then, if I remember this all correctly, City of Clearwater, City of St. Petersburg, and all the different municipalities who were investing money. When you say, you know, it's really a combination of all the sort of jurisdictions, correct? Or did that change?
So the other municipalities are still involved. City of Clearwater is a donor at $100,000 a year. City of St. Peter's donor at $150,000 a year. The other cities, you know, donate what they can every year. It's based off.
I
their
think it's
budget.
400,000 total.
It's, yeah, depending on the year, and then the budget allotments is between 300,000 and 400,000 each year.
Okay. And what about the resources from, I can't remember the name of the group up at SAB that does grants all the time?
So our grants administration, yeah, do they look at opportunities? Yeah. Have we applied for some? Yep. And it's.
But you know, like, we're getting ready to send money back, right? Like ARPA money and ESG money and funds that haven't been spent in Pinellas County, right? And so all things homeless services are eligible expenses under those dollars. So that's the kind of my question. It's like, are we not able to tap all of that for this because it's jail diversion? And if we called this and said that this was a homeless shelter, the largest homeless shelter, could we then align these funds with this thing?
Well, there was some conversation at the meeting with the sheriff around using ARPA dollars, and it became a conversation of they're not a nonprofit. I think Mary went and did some additional research to find out there is a way to do that through an interlocal and some collaboration with a nonprofit. So there is some potential there. I do think there is some opportunity in defining it, right? So in our HIC, we don't have a high bed utilization rate for shelters. So we're never going to be able to convince people we need more shelter space, but I'm convinced we have the wrong type of shelter space. We have a graying population, and sleeping on a mat at Safe Harbor is not dignified. And so we need to define this. I mean, I'm not, you know, sometimes I throw out harebrained ideas just to get the conversation started, but if there was ever a time to take these beds out of our HIC, which is our housing inventory count you saw in your packet today, in my opinion, it's during COVID, because HUD's not looking at our housing inventory count in the same way, because beds are closing every day because of safety issues. So I think that's one thing. If we're not going if we're gonna say, no, we're gonna keep them in and that makes sense, then we need to invest these resources and we need to figure it out. And maybe we need to try some other 90-day pilot things that I didn't think about when I saw the report the first 3 times. But I'm thinking about, from time to time, we hire somebody contract to do some cleanup in HMIS. Is there a way that we could help Zach's people do that follow-up so that there are more positive exits? If we're going to have it a homeless shelter and it's in our system, it's affecting our system outcomes, which ultimately impacts your ability to bring in federal dollars. And so maybe that's something we should try for 90 days and see how it works. Or, one thing I've thought a little bit about is in other communities, when they have large encampments, they have, an all hands on deck approach where they bring everybody together. And we do it all the time, right? We did it when the Mosley Motel closed. We did it when the Stanton Apartments closed. Do we do that for a specific population, our vets or our chronic at Safe Harbor? And when communities do that, they often have a separate by name list. So those folks get prioritized in a different way. Is that something we should try? I think there's a lot of conversation that needs to happen. And I do think in some way we have to decide, is it jail or is it a homeless program?
All right, I'm gonna go to Ross. I want to be respectful of our agenda and time. So if we have any last burning questions or comments, and then I'm gonna try to wrap us up, and maybe we'll go to Ross and then.
So just kind of following up on your comments, is there a committee of this group that some of this discussion could be deferred to? Because we're kind of at we're already past the turning point, I think, where we have a significant spike in homeless people because of our inflation and high housing costs. And so now we have different categories changing, and how can we take this underutilized resource in some ways, because there's empty beds, right? And use it better, whether it's a drive-in shelter or it's something else, maybe something else creative like you're describing. So, but is there a committee of this group that we can?
So the next step for this will go to funders for some conversation. That street outreach meeting that happened this week, they also want some stuff to go to funders for conversation. And I think ultimately we need to form a task force. The 2 issues are intricately connected. And I think ultimately we need a task force of this group and others who want to focus on those 2 issues to continue some of this work. So if you're interested in that, please let me know. I'm certain that it'll be on the next funders agenda, and then I'll add people and we'll get something scheduled.
We'll go Trinia and then Peter.
Okay, I think that might make my comments and questions much shorter. I'll recommend to be a part of that task force, because you keep throwing out San Antonio like that's a best practice model. So I want to look at the comparison in terms of what we have at Safe Harbor as opposed to San Antonio, if that's the model. And I may have not gotten that correctly. And if I didn't, that's fine. But I'm always for best practices for the most impact. And I'm not for turning money away when we see more and more people getting on the street because of inflation. So I recommend to be a part of that task force.
All right, thank you. Peter?
Yeah, I was looking at the homeless shelters, and I wanted to ask if there was, and I'm new to this, I'm scratching the surface, so I may be wrong in some statements. If there was a homeless shelter in Tarpon Springs, and so send those beds up North County, send them to Tarpon Springs. Let's, our residents want a homeless shelter to be able to help those in need, because the issue is, and the Shepherd Center is a great organization that I believe has good funding, where we can do some type of agreement to provide a homeless shelter for those in North County, because there's assumptions that people are being fed through the Shepherd Center, but not given a place to sleep. And when you have such a wide range from North County to Mid County, it creates harder way for people to have a shelter to sleep at night. So, my job is to obviously look out for Tarpon Springs and the best interest to be able to provide that for those in need. And I would really like to work with the organization to provide a homeless shelter in the future in North County to help, separate all those that not force everybody to come down to the county, because it's a long way from up there.
Yeah, but this is just a quick question. So I know we gotta go. Sean. Is the perception here, and I guess I'm asking April and asking GW, that a big reason why people don't want to come to Safe Harbor because they perceive it as jail? I mean, you know, because I'm asking.
Yes.
It's because it's not safe also.
So-
Okay, well, there, you can say that about a lot of things. I'm just, is it would the perception change if, and I'm not committing, I'll pick a different agency other than April. If PERC decided, hey, we're gonna, you know, manage Safe Harbor, is that gonna change anything? Because a nonprofit came in and it's no longer the sheriff's office. That's why I'm asking.
I think that it would, because when you're on the street, you're already criminalized, okay? And so, it's kind of like Maxwell turned on its head, okay? So, everywhere you pee, and if you want to do anything that you do inside, okay, it's illegal to do outside, okay? Relations with your wife, just like a drink beer, you know, it's like a watch TV, relax, build yourself esteem, okay? That's all illegal outside. And so the police are constantly in your life, okay? And so when you go out there and you, people feel that they're surrendering themselves, they're voluntarily going to jail, even though that may be the furthest thing from jail in the world.
So I'm gonna close it out here. First, I have a question or two and a couple comments, but I want to thank you for, this is obviously got a conversation started, and that was the purpose of this. And I'm glad to hear that we have parties that came to the table and we need to grow the tent, obviously. I was doing a little back of the envelope math on it wasn't in the presentation, but it was in the backup, but it looks like for the case management and everything that's being recommended, it's about $1 million, a little bit more a year that would need to be funded to get to the staffing levels that is being recommended. Is that about accurate?
Probably, I would say with the new services, with rapid rehousing, case management, part of the health commission in there, that can help wrap around and get help as well. So probably about that level. I guess one of the other things too, with, I think someone touched on it, is we have an immense amount of COVID money in our community right now, which has, most of it has to be used by 2026 or sooner, but what impact will we make in that time period to really get to almost functional zero with the population in that time period, so that it is a manageable level too when that funding dries up.
And then what's the annual operating budget for Safe Harbor?
A little over 2 million.
2 million, so about 3 million annually would get us to kind of where we think we need to be in annual funding. So I would, you know, obviously, I love the idea of setting up a task force or having those further discussions, whatever comes out of that. I know it's going to funders, but it sounds like there is potential opportunity here with the sheriff's office and the sheriff to maybe do an unsolicited proposal if you're a provider or your consortium of providers, and see how much funding that can be provided by, whether that's the building and other funding sources, whether that's other resources from other counties. We know it's about 3 something a year, right, at the current levels. I would venture to guess that staffing it with nonprofit salaries is a little bit, and fringe benefits is a little bit, I don't want to say cheaper, but than the sheriff's office. And what we pay deputies and whatnot. And
But if you're gonna wanna recruit and retain staff to work.
listen, I'm not advocating for less money. I'm just saying that the benefits associated with it, you may be able, there may be some cost savings here. That's all I'm saying.
Every program like this that's run by a nonprofit, from visiting them, is they have a lot more staff because the staff isn't quite as expensive. And I think to your point, what's unique at this moment in time is we do have this ARPA funding, and could we create something to use as a transition in these 4-year programs from the sheriff's office to, so we don't have to do it next week, and we could kind of do it as a transition and use some of the funding that way. I think that that's a logical conclusion to what you're saying, Sean.
Susan?
Yeah, I just wanted to say they have virtually no turnover in their case management staff. That's one of the strengths we found, that it's a very consistent staff now.
Yeah, so I mean, I think there's the opportunity here, it sounds like, and hopefully we can, because the jail diversion versus homeless shelter is a huge issue for funding and for, you know, just operations. And there still may be some funding for jail diversion within a homeless shelter that you could get, you know, it just seems like there's a lot of opportunity. So we will follow back up on the funders. I'm sure it'll come to April's point. I think this could be a whole board meeting, and maybe it will be one eventually. But again, thank you for your time, energy, and efforts, and we'll be hearing more about this, I'm sure. So we'll move on to the next agenda item, which is the Hmis Charter, and I believe Brian is going to be taking that.
Hello, everybody. I am standing in for Cindy today to talk about the Hmis Charter. It was approved by Data System Performance HLA, or the Hmis Governance Committee in March. So I'm going to bring it forward to you for the annual review and approval. We basically made a few just language changes to bring it in line with what HUD's language is, primarily about the making sure that agencies receiving federal funding are participating in compliance with the federal requirements. And then just updated the list of reports to include some of the new HUD reports. So it's just basically bringing in line with the current HUD standards for Hmis governance, some minor language changes, and that's really it. So if anyone has any questions, I'd be happy to answer them.
For newer members, I'll just kind of explain very briefly that the HMIS has a charter. HMIS stands for Homeless Management Information System. They are required to have a charter which kind of governs their work. So does the CoC, the Continuum of Care, which is the board you're sitting on today. Both have to be updated annually. So this is a housekeeping governance item. In the past, there's been significant updates. This time, it was more minor updates. So just wanted to kind of explain that this is something you'll see over and over again, because every year we have to update all of that information to be in compliance.
Any questions?
Motion to approve.
Do I have a second?
Second.
Okay, any questions or comments? Hearing, seeing none. Do we have any online? So keep forgetting about that. All in favor, signify by saying aye.
Aye.
Any opposed, signify by saying nay. Hearing no nays, motion passes unanimously. Thank you to the HLA staff for all your work on this.
I do just want to throw out a signal here. HUD did come out with a recent lead series for HMIS with some recommendations. Some of them are recommendations, some of them are requirements. We have unpacked that through multiple departments at HLA, and we'll continue to look at it. As a part of your annual review of us as your contractor for the CoC, HLA as the CoC, the executive committee has been working towards that. It's going to come to the board at some point. One of the things we've talked about is having some, like, even though we have a strategic plan with a lot of goals that we accomplish for you, is having like a quick, you have your MOU you have with us, but having, you know, a couple goals each year that we look at. And I just want to signal that there will be quite a few HMIS goals that will need to come forward to get us to where HUD would like us to be. So for example, you know, their end user ratio to staff is much lower than where we're at. And it is the responsibility of the CoC to plan for the funding resources to make that happen. Not a lot of people want to pay for data though. So we will continue to work towards that, but there will be some goals around that. There will also be some goals around bringing you guys together to help us inform, what do you need your platform to do? So when they evaluate their vendor, they can be using your end users' feedback towards that. So nothing for today, but I just want to signal that you'll be seeing that in the coming months.
Thanks. Okay, so we have, the next agenda item is funders and providers recommendation for local funding. This is super important topic, and I'm sure there's gonna be a lot of, well, there could be a lot of questions and discussions surrounding this, so I want to give it the time it deserves. But I will turn it over to Amy, Duggan, and April. Whoever wants to go first.
I'll kick us off. So we did this a little bit different than we've done in years past. We've done it a lot of different ways where everybody got into a room and tried to come up with recommendations for our local funding. That's always been challenging. There's been concerns about providers not being able to take off their own hats, funders not understanding what providers need, us not using the data to drive our decisions. And so this year we tried a kind of bifurcated approach where funders looked at what interventions they should focus their money on. So whether we should do rapid rehousing or prevention or permanent supportive housing, and then providers followed up that meeting in the same week and looked at what target populations they would like to make a priority. And so that was the process this year. We did provide a significant amount of data around this. I'll just let you know that I think for funders, it was really helpful to see some of that data. So that will be a part of your membership meeting that we're going to talk about later today, that we really want our community and our elected officials and the general public to know kind of that state of the state. Where are we at? What are the needs? And we're going to talk about that more in the membership meeting coming up later this month. So with that, I'll turn it over to Duggan and April with their recommendations.
Sure. So the Funders Council had a joint meeting with the Pinellas County Jurisdictions team in early April to talk about the funding priorities for 2022. And we reviewed the data first. And this also came out of a prior Funders Council discussion wanting to have that joint meeting with the jurisdictions group. And the recommendations after reviewing the data came from that team. That in order, funding priorities would be for prevention, then rapid rehousing with a focus on housing navigation, because housing navigation has been explained as one of the ways to help remove some of the barriers to the challenges we're having with more appropriately activating our rapid rehousing, and then after that, permanent supportive housing. And so I'll leave it there. Questions?
April, anything
Around the priority, around the intervention priorities,
around the process or yes?
Your target population.
around the target, yeah, so, so we then had a discussion, we had the discussion absent this information, by the way, so we were not focused on the interventions, that was what the Funders Council was paying attention to. I'm trying to get to on my thing.
No,
here.
you actually almost didn't take action because you didn't agree with the funder
Council. Oh, remind me of that. Tell me that.
I don't remember, but I know there was a concern, somebody that was there was a concern that, because non-congregate shelter wasn't considered a priority, and there was concern
Yes.
about the number of families on the street. And so how do we choose
Yes.
families as a target population if there's no investment in getting the families off the street? That's what it was, sorry.
Yes, that is exactly what it was. So that's what I would say about this list, just so everybody, has that information. Prevention makes a lot of sense as a target intervention. We saw with the data that there was, I think, like 1,000 individuals or families who were prevented from hitting the street over the last, someone would have to check me on the data, but on the number, but because we were investing in prevention, we were able to do quite a bit there. But between prevention and rapid rehousing, there is a need. And we are not recognizing the need between prevention and rapid rehousing. And so I would just say to everybody, we currently have, I don't know what the number is, someone have to check me, 80 families on,
Probably 73.
73 families on the street, 73 families on the street. I was notified yesterday from Largo High School, right? We've got a high schooler living in her car that doesn't work with a infant. The day before, I was notified of a 4-month-old with his or her mother in a car that doesn't work, living on the street. And I don't even know if those two have made their way to the list of 73, quite frankly. So there's a lot that happens between prevention and rapid rehousing. And so because we are not prioritizing, for example, non-congregate emergency shelter, or even, quite frankly, emergency shelter for families, which often comes with a price tag, what that means is that we will not be prioritizing funding sources for that, which means that families will in fact remain on the street. And I just don't know if everybody is understanding when we talk about these numbers. We never before, pretty recently, you would have to tell me, but we have never before kept an active list of families who are on the streets. And so I think that has been tremendously helpful for us to keep that list, because historically, there's been some debate. Do we actually have a homeless family problem? Depending on who you're talking to, and when you're talking to them, we don't, we do, we don't, we do. There is no question right now that we do. Like, if anybody in the room is still questioning whether or not we have a homeless family problem, we now have the data that says we absolutely do. And in fact, we have 73 plus perhaps these 2 additional ones. I don't know if they're on the list or not, with little bitty children who are living on the streets. So that was our concern about this. It'll make a little bit more sense when I tell you that the priorities that we then came up with as to why we then would be concerned with this, with these priority lists. So I'm trying to find the minutes. The first priority is families with young children. And I'm forgetting the age, 0 to 5. So that we would prioritize children 0 to 5, then families with children ages 6 to 17, then chronic homeless living on the street as defined by HUD, and then unaccompanied youth and those aging out of foster care. We did, what isn't here is the 65, 62 and over.
Oh, that's right. That was a dual. Thank you. So there was a dual first priority because these were in order.
Yes.
And so it was families with children 0 to 5 and 62 plus.
That is true.
We'll make that adjustment.
Yes. And they were a dual first priority, again, believing that we, as Amy said earlier, we are a graying population. So we are starting to see a significant number of individuals over the age of 62, quite frankly, over the age of 70, who are now living street homeless. And concerns, just so you know, we met with a variety of our shelter providers on this graying population. All of them are expressing concerns about the needs, the ADL needs in particular of this aging population. It is not easy for this population to get on the floor, to sleep on mats. They also have trouble bathing themselves, toileting, a variety of things that just come with aging, that shelter providers are not generally equipped to handle, and certainly not Safe Harbor, which is one of our only, low barrier shelters. So in any case, it was 0 to 5, our little bitties, 62 and over, then our 6 to 17s, and then those individuals who are living chronically homeless and those aging out of foster care.
So I'd just like to speak to the recommendations briefly from the data perspective. Data got bumped this meeting, which is great because there's a robust agenda. But usually the data is very repetitive. The thing that was most remarkable this last quarter of the data, is that we had a decrease of more than 2% in Black families and people entering the city, engaging with the system of care. on the surface, that sounds like a good thing in terms of progress towards equity. It's actually a bad thing because there was a decrease of 10% in street outreach serving Black clients and a decrease in 6% or 7% in homeless prevention serving Black families. So what that really means is the programs that are getting people out of housing don't have access to those families anymore. So our equity score got substantially worse this last quarter. Most of that, I'm gonna say, is because of the end of our targeted prevention programs that focused on specific areas that have high concentration of minority families and people, and the end of our funding for non-congregate shelter, which means that people and families are hiding from street outreach instead of running to street outreach, because street outreach, frankly, doesn't have something to offer them that will get them off the street right then. So if we're serious about our equity commitment, we need to think about how we're replacing the targeted prevention with new targeted prevention, and how we're, to April's point, fitting that gap between people who can be prevented from homelessness and people who can be rapidly resolved in homelessness with some additional funding. There are all these great financial assistance programs out there. I'm not sure we're always connecting the dots and targeting the right place. Right now, effectively, most of our prevention dollars are in DA serving programs because that's where the money is. That means we're serving a predominantly white population in those programs, and we've lost a lot of our opportunity to serve non-white populations. So we took a step back.
Can I say something? From what he's saying, myself and April and you, Amy, do a lot of work whereas I refer people to you, and it's not getting any better, it's getting worse. The primary reason that women give me for not seeking help or care, first of all, they don't understand. And second of all, it's like they're worried about the way they're going to be perceived. Third of all, and this is consistent, they are worried about exposing their vulnerability and people taking their children. And so blacks don't play that, you know. And so, it's like people are in their cars on the street, women compromising themselves, trying to get a hotel or something for their children. So
I do want to follow up to Sam's comment, and just Teresa added about their non-congregate family shelter starting shortly. I do want to mention, because Teresa did help funders remember this distinction, that because of the funding source of this shelter, it can't fund anyone in the city of St. Pete. It has to be 65% AMI or lower, or from a qualified census tract. So for other people planning programs, it's really important that you understand that this city of St. Pete money doesn't cover everybody that's going to be homeless in St. Pete. But to Sam's point about the targeted prevention, we have been watching that data. It has been concerning. We have a unique opportunity this year that DCF has got their hands tied with a lot of different things. And so at the end of our 3-year unified contract, instead of having to bid that again, they are allowing a 1-year extension. And with the funders vote, we have asked, we haven't received an answer yet, but we have asked that 100% of our regular ESG dollars, because we're out of ESGCV, which is why there isn't targeted prevention and non-congregate shelter, but the regular ESG, instead of going to rapid rehousing, go to prevention and targeted prevention. They bristled at that a little bit. They're like, so you want to work with non-homeless clients now? I'm like, no, our ERA funding is ending this summer. Our racial data is telling us that we need to focus on this. And so we're hopeful that that's what we will do. It's a very small amount. It's $200,000, I think. But to your point, the targeted prevention has made a difference, and it matters. And so we've got to bring that back.
Well, targeted prevention worked really well. But in addition to that, and to Sam's point, the non-congregate emergency shelter for families also worked to get people off the streets. What didn't work about that specifically is the exit plan was a challenge. So while we could get them off the street and keep them off the street or out of their cars or out of the woods, the lack of housing stock meant that, and even places that will accept vouchers, so we had an increase in vouchers available for people as well, which has been tremendously helpful. But the rapid rehousing, people were getting stuck in non-congregate emergency shelter, and we ultimately were robbing rapid rehousing funds to keep people in non-congregate emergency shelter because we couldn't exit them to rapid rehousing. And when these little nuances aren't understood by funders and there isn't flexibility to move quickly to move funds from one pot, such as rapid rehousing, to another pot, such as non-congregate emergency shelter, we actually run the risk of having kept families in non-congregate emergency shelter for 16 weeks, and now they're going to exit to the streets because we can't actually exit them to rapid rehousing because we don't have the housing and sometimes even the money because we've robbed rapid rehousing to pay for non-congregate emergency shelter. In any case, I just want to continue to say from a funder's perspective that many of us should be attending Funders Council to the extent that we can. Because we've got to continue to say, especially to our jurisdiction meeting, funders meeting, that there are funds that have not been spent, and some of these things could be ramped up again. And sure, those funds are going to expire eventually and all that kind of stuff, but we should nonetheless use those funds that are available.
I was gonna add, I mean, I think that is what we're seeing even in the non-congregate that we do have available, the length of stays are much, much longer than what is desirable and where we want them to be, which I think is what led us to that housing specialist focus, so that like that extra support to help people flow through the system, so that way it would open up more availability, so the length of stay would be shorter.
That's exactly right.
And we just have to appreciate, though, that if we agree to this, right, that we will have 80 families with little bitties on the streets. That's all I'm saying. And so if we're all good with that, then we will say, okay. But if we're not good with that, then we have to understand that a different and or perhaps another intervention has to be added to the list. That's all I'm saying.
Sam? So I think I'd love to hear what that intervention is, right? Because I don't think anybody's good with 80 families living on the street. So I don't think that's the vote anybody's interested in taking.
Well, I think the challenge, the challenge is at the time that this recommendation was made, ESGCB was ending in September. ESGCB allows non-congregate shelter. Regular ESG does not. So when this decision was made, there wasn't a funding source for, that's why non-congregate shelter went away, right? So I think that's the challenge. You can, see Teresa, the city put in ARPA funds. They're going to do non-congregate shelter that will take care of, Teresa, remind me, I have to look at my notes, 34, 50 families at any one time.
It's actually 25 at any one time, anticipated 50 over the year.
50 over the year, so it was 30 something beds at a time. The county is renewing their bridge contract, which is 13 beds off the top of my head. Those are not new beds though. Teresa's beds are new. So to April's point, there is still a gap. The question is, what's the funding source?
And we're continuing, they'll get, St. Vincent's will get a little bump, but we're almost at 900, well, we're just over 900,000 now for next year for the non-congregate.
And
so we'll continue that.
And the county, I forget, did take, add 25 beds with ESGCB to St. Vincent de Paul's program as well. So that gets us down to 20, but right, there's 30 people coming in a month.
I think one thing I also want to say about I really appreciate the priority populations that you identified in terms of those targets. I voice the same concern I have with that, with making those priorities exclusive, because I think what we've seen in the past is sometimes when some of those families are hard to house because of housing stock. I think we need to keep some capacity in the system that can quickly house people who are singles, who are not on the priority list, but might be able to be easily resolved. So it's just finding a way to keep those priority populations at the top, but also make sure we're also doing some throughput that we can do, housing other vulnerable.
So one of the things that's come up, I feel like in a couple of the meetings we've been at, and I don't know if you guys have different insight into that, is, and I'm not a proponent of sending people to other counties necessarily, so please don't take it as that. But some of the limitations of, like, if someone does find a place right over, you know, the Pasco-Pinellas border, and depending on the funding stream that has come up as a barrier, so I don't know if there's brainstorming too, that, like, I'm even having that conversation internally about, like, what can we do to try to remove those barriers?
So those are all funder-based barriers. The city of St. Pete recently removed that barrier after had put in writing that they have that ability. It's about client choice, and clients get to choose where they want to live. Largo and Clearwater have always been flexible with their dollars to say, with federal dollars, people have to originate here or they want to have to move here. But, you know, they have a little more flexibility there. I do think there's a conversation needed. The federal dollars are harder to change those requirements on, but local funders certainly with their own dollars can make different recommendations.
I have a question. Is North Florida Family Support Services a member of this group? So I think they took over the EPIC contract. Are they a member?
They are not.
That need to be reached out to, because it's a concern for some of the mothers that they're not coming forth because they have fear they're gonna lose custody of their children, maybe issue a termination of rights. We need to make sure we have a conversation with them.
We're actually speaking at one of their meetings in next month.
Thank you.
So we have two separate agenda items, but they're joined. One significantly impacts the other. There is differences, right? So we don't, my opinion, want to misalign our funding priorities with our priority populations and the interventions they will require, because then we will just be doing the same thing that we will just be creating a barrier, in my opinion. We need to resolve this. I can't make a motion, somebody else can.
What's the motion we're looking for here? Like,
That's,
You could take up the recommendations separately, you could take them up together, you could alter the recommendation. Just as a reminder, because providers did consider not making any recommendation, I recommended against that solely because Teresa, the county, others who are sitting on this call have social action funding open now or about to come open. And they use these recommendations to be tiebreakers and determine, you know, what the needs are. And so we can either be silent on that and let their processes take place, or you can have a recommendation. Because this is solely for local funding.
and every year this conversation is never easy or quick, because we're picking target populations and interventions, but it does inform a lot, and it does align funding throughout our CoC. So it is a big decision. I think it's something that the board needs to make and address, because social action, you know, to Amy's point, funders are going to start funding.
Can I just ask a question of Duggan? And, you know, is there, so I heard Amy say that one of the reasons that Funders Council did not consider non-congregate emergency shelter as a funding priority is because there wasn't a funding source. Is that what I understood you to say?
I mean, I just was we spent a lot of time about this source is ending, this is what will continue, these are the allowable actions of each. So there was some conversation about that.
And a good part of the conversation was about setting priorities in a way that sort of aligns with how, like providing us some runway as these funding sources are ending, in order to, make sure that we're funding things that have been working. So that's why prevention ended up as number one. Because there's been a ton of prevention funding in the community. It is working. We see that play out in the data. And then the rapid rehousing got in there. It really is we're talking about the focus on housing navigation. Because the barrier has been surfaced that finding housing in this market is difficult. It is a barrier to getting people placed. It's what's taking longer for people to get placed. And if there was more help in the housing navigation part, rapid rehousing would possibly happen more quickly. And so that's how that made it in there. And then permanent supportive housing has been on the list as a priority for a long time. We know that we need more permanent supportive housing units in the community. That's no mystery. But the prevention and then really the housing navigation related to rapid rehousing is either data pointing to success of the intervention or removing the barrier.
I would make a motion that we prioritize the recommendations from the Funders Council with a sense that as funding becomes available, we look to fill gaps, address vulnerable populations in a way that's flexible. And I think that if our providers and our HLA staff are seeing places where there's a cap on dollar amounts that has not been responsive to inflation, especially with housing prices, we grant some authority to overcome that barrier, solving the case.
I second that.
Discussion.
I do not think that action or that motion will solve the problem that I am largely concerned about. I appreciate what Sam is saying. I just don't think that it will do what needs to be done, and that this is our only opportunity to say to our local funders that, who, by the way, took action years ago after misunderstanding one sentence that came out of, I think, a CoC meeting. They all went back to their respective, places and took immediate action that hotels could not be used. And so I would just say that we need to use the opportunity to say to our local funders that our children with little children and our elderly are important to us. And if non-congregate emergency shelter is the only option, that we should be using it. I would argue that with these priorities, especially rapid rehousing with housing navigation, could in fact help us solve the problem of them languishing in hotel. I don't think, however, that it's going to eliminate the need for hotel. So I think we do have to have something between prevention and rapid rehousing to allow then the priority of housing navigation for the purposes of rapid rehousing to work.
April, what I'm not getting is what's your proposal? Like, I want to support what you're like, what is it? Like, tell me.
That we would fund, as a funding priority, that we would fund non-congregate emergency shelter.
As one of those priorities.
Yes. To your own point of your own data that you said earlier, right? They're not reaching out to street outreach because there's nothing for street outreach to do for them, right? Because we took away non-congregate emergency shelter. So they have just now become more hidden again because we don't have an intervention for them. Where's street outreach taking them right now?
Right.
Nowhere.
So let's amend the motion to include non-congregate shelter as a third priority.
fourth priority.
Sounds good.
Is that an amendment?
That's an amendment to my motion.
Well, please restate it.
Okay, so, yeah, totally fair. So, my recommendation would, my motion would be that the local funding priorities for 2022 would be funding prevention, rapid rehousing with a focus on housing navigation, permanent supportive housing, and non-congregate shelter in that order.
With Doug, you were the second.
I'll second that. And non-congregate shelter is the fourth priority on that list in order.
Sounds good to me.
Any further discussion?
I think, I would add non-congregate emergency shelter for the priority populations that we're getting ready to take a vote on second. So I do think non-congregate emergency shelter should be narrow to families with dependent children, the elderly, our priority population. So we have that as a number one. The number two is 6 to 17.
How was that operationalized with communicating to our funding partners and to the community?
And we provided the recommendations and
Is it like bifurcated like this? Like this is the,
we've never done it this way before, so.
I have a question, if I can too. Does it make sense for the amendment to be specifically non-congregate, or would we just want to say emergency shelter for the family?
I think it's non-congregate emergency shelter. That provides some maximum flexibility for emergency shelter.
do you want to amend the amendment for more clarity?
So in terms of keeping the priority population with being specifically focused on the priority populations, especially with the non-congregate.
I mean, is there an issue adopting the priority populations as is for the entire set of recommendations for funding priorities? I mean,
Yeah, that's
that would apply to all of them inclusive of the non-congregate shelter.
I think that makes sense.
Yeah.
I'll retract that second.
Why don't we just withdraw that, make a new
Yeah.
motion, and
Start
it'll
with
be
Sam.
clean.
You got it. So I move that we recommend local funding for priorities for 2022, funding for prevention, rapid rehousing with a focus on housing navigation, permanent supportive housing, and non-congregate emergency shelter in that order.
Second.
I second.
Well, now that we have a third, we can move forward. All in favor signify by saying aye.
Aye.
Opposed, say nay. Hearing no nays, motion passes unanimously, which that didn't include our target population.
So then I'll move that in relation to the local funding priorities that have been passed by the board, that we identify and connect the local target population priorities for 2022 as being families with children ages 0 to 5, and also at the same time, number one priority being those 62 and older. Families, then second to that, families with children ages 6 to 17, followed by chronic homeless living on the street as defined by HUD, and the last being unaccompanied youth and those aging out of foster care as the population priorities that are related to the funding priorities of the board passed.
Second.
Any further discussion? Hearing, seeing none, all in favor signify by saying aye.
Aye.
Any opposed signify by saying nay. Motion passes unanimously. Thank you, funders, providers, and everybody for their input on this. It's never an easy topic. We'll move on to the policy updates. VI Spadai, Harley.
So I'm gonna be covering two policy updates for Coordinating Management Policies and Procedures. I'm gonna move quickly in the interest of time. If you have questions, please just stop me. So you can see it's on page 59 to 62 in the packet if you're following along, so I'm not gonna read it verbatim. But the first policy is about those who score 0 to 3 on the SPET. So what that means is they're in a no housing intervention recommendation category. Right, so they're not going to be referred to rapid rehousing, of course, not PSH. So at that point, we're thinking of them as a self-resolution category. And we had no policy previous in our policies to this. We kind of just like followed what we thought was best for a family, but we realized a lot of people were getting left behind, especially individuals. Especially right now, what's going on in the community, a lot of the issues are just rent affordability, housing inventory. So the needs are actually pretty low for a lot of families. It's their first time homeless, same thing with individuals. So they're scoring pretty low. Usually score high if you've been homeless for a while, you've been in the system for a long time. So we're seeing a growing number of these families and individuals. So our policy basically states that if a family or individual scores 0 to 3, we refer them to diversion, or if it's a veteran, to rapid resolution, St. Vincent's Paul. If they return back into the system for needing shelter again, or they fail in that intervention, they come back to a navigator, basically who reassesses them. If they score above a 3, they stay on the list. If they don't, they're closed out at that point. So one of the caveats or things in here are, if a client scores 0 to 3, it does not mean they're denied entrance to shelter, right? They're still homeless. So we need to keep that in consideration. I know that we can't really see the light at the end of the tunnel, right? So we know they're not going to get rapid rehousing, but it's important that we still consider them for shelter. Let's see, there was one more thing. Oh, of course, if somebody doesn't feel that the person really is 0 to 3, but somehow the scoring is 0 to 3, we can advocate for them. So we'll be starting our individual by homeless meetings, just like we do for families and veterans. We'll be once a month. We're having our introduction meeting on June 2nd. You'll be here for me. And those will be case conferencing a lot of the individuals on the list. And we're going to definitely focus too on those 0 to 3s, right? Because we know they're not going to get an intervention. Any questions?
The conversation, again, just for the benefit of new people, the conversation historically has been that families or individuals who are scoring 0 to 3 were had the greatest opportunity to self-resolve. In other words, there's been this conversation that 0 to 3 would suggest that, if they put a little elbow grease into it, they could self-resolve on their own and not actually enter the crisis response system into shelter and that kind of thing. Can you just speak to that for just a second? I know that you said, right, we're seeing new homeless as a result of lots of things that have happened over the last 2.5 years. So can you just speak to that? Because I think that was the reason we had the 0 to 3.
I'll just kind of mention, I think it's a bad use of semantics, right?
Okay.
Self-resolve is the term that they use in the homeless crisis response system. It was never meant that they self-resolve. And so this is formalizing the idea that we don't say, put some elbow grease into it, that we are still wrapping you with some services and helping you along that path in hopes that you don't come into the system. The other reason for the need to kind of formalize things we have informally been doing is shelters are starting to say, they're 0 to 3, I don't want to take them, because that means there's no exit plan for them, right? There's no rapid rehousing, and that is not acceptable. People who are in crisis need shelter now, regardless of what their exit plan is. And so it felt like the right time to make that distinction.
Yeah, in our terminology to self-resolve, we can think of one-time financial assistance payments. Right. So like with the new ERA, we had a family who scored a 1 or a 2. It was 2 parents. They both worked. They brought in about $80,000 a year, but they had several children. They could not locate a housing affordability or anything. So they're on the list. They're literally homeless. And we told them about ERA. You can stay in 30 days in a hotel, and then you can get reimbursed. And they go from there. They just need financial assistance all the time. Maybe they were out of work for a week because of COVID. They fell behind on their bills. They got kicked out on their month-to-month. So it's not like Amy said, they're not self-resolving, like they just woke up one day and they're like, I'm gonna go get a house. Like, right, they can't do that. So it's like they need assistance. But we didn't have a process to make sure that they got in contact with those people that could assist them with that one-time financial piece or anything else that they may need at that actually directs, this happens, make sure it happens. If it doesn't work, we'll look at them again to get like a second chance.
Did that answer your question, April?
I think it does. I agree, I agree with this thing, right, that we were suggesting, perhaps maybe by, unintentionally, and maybe even by design, that people on the zero, with the 0 to 3 score shouldn't go into shelter. We should be kicking them out of shelter and preventing them from going into shelter even because they can self-resolve. The issue, I guess, is that the second part of it is, but they then still are not eligible for rapid rehousing.
Yes, but this is why we say look at the score. If you have a family that's 0 to 3 in your shelter, nothing worked, it's possible the score just isn't right, right? And so we encourage that you're updating assessments and that you're looking at that, because the reality is if someone's scoring a 3, can't get themselves out of shelter, can't save any money, there's something wrong there. The score is not reflective, which is why it's amazing that we'll have a new assessment hopefully where we don't have these finicky little issues that we're dealing with. But that's also that part of that adaptation on a navigator to say, this person's been in my shelter for 3 months, they're not a 3. Well, you need to step up and you need to say something so we can fix that.
I think the other thing that this policy really brings forward to me, and I feel like it was clear in both providers' discussions and funders' discussions, is we almost need a whole new type of intervention we've never used as a COC before. So, you know, I think about the people on the margins, the 4s, the 5s of RH are never, ever, ever going to be picked up. And so how do we rapidly exit people from shelter without RH? It's that one-time financial assistance. We need to think about new programs that we've never had before for those 0 to 3s, for those low scoring RH, even for some of our low scoring PSH. We need some other intervention we haven't cooked up yet, right? So I think that's one of the things I feel like has come forward over the last year to me.
That's all from that policy. You want to move to the next one?
Yeah, because I think they're, what, we can take them all. Yep.
As in we continue, okay. All right, so our next policy is an existing policy that we're updating. It's our inactive policy. And so our inactivity policy as it stands right now is that someone becomes inactive after 90 days of not touching any homeless resource, no street outreach, no rapid rehousing, no shelter, no neighborhood centers like Tarpon Spring Shepherd Center, anything like that. They've disappeared in 90 days. We can't get a hold of them. The problem with this is it doesn't make the system efficient when you have hundreds and hundreds and hundreds of people in the system that need resources, right? So this policy that we're trying to change is that becomes 30 days of not touching any resource in the community. Right?
No food bank.
No food banks. Anything that they may access, especially because we can capture into my answer through street outreach. The problem is right now, for one example, is say that I'm referring to a rapid rehousing provider for individuals, right? There's hundreds of them. I'm going through, this one doesn't have a phone number. We haven't seen them in 45 days. No one's seen it. That's a long time for me to just hope and make a referral. So it's not efficient. We can't efficiently move people through the process or the system. And so if they hit that 30 days, they would move to what's called an inactive list. And at that point, they would be off the coordinated entry list for referral, but they would have a leeway of 30 days. If they touched it again in 30 days, they bounce back. Once they hit that 60 days, they're closed out of the system for good. And should they return after 60 days, someone's going to have to review the assessment and put them back in the coordinated entry. So you give that 30 days. So 40 days later, oh, they pop into the Shepherd Center. They're just going to automatically pop back on to the active list. And it's just really to make the process efficient. You can't have an efficient coordinated entry if you're waiting 89 days and referring someone to rapid rehousing that you haven't seen. It just doesn't work.
This is a recommendation from our Built for Zero work, and is something that many other communities have shifted to. So,
Can I ask a question on this one? And it might be for you, Amy, or the both of you. So right now, and I'm just thinking of the street outreach meeting that just took place and a couple other meetings that have recently taken place, even like Safe Harbor and other things, is that, so for example, the city of St. Petersburg to my knowledge, and I think Teresa is on, maybe she could speak to it, maybe Amy knows, but to my knowledge, in the city of St. Petersburg, the people, there are a lot, the PAC team, let's just say, the PAC team is interacting with people and responding to people who are homeless often, right? That is their sole like focus and responsibility. And yet they do not have access to HMIS. So the way St. Pete is operating, if I'm understanding from our meeting this past week, and I did not know this until this past week, I think I knew it maybe, but I wasn't putting the dots together, is that, so when the PAC team interacts with somebody who is homeless, they don't have access to HMIS. So we're not putting in HMIS that we've had an interaction with this individual. We've fed them, we've given them resources, we whatever. What they do in right now currently is they contact the street outreach team, Elijah, who works for Directions for Living, then enters and or goes into HMIS, provides that information to the PAC officer and or enters that information into HMIS. We are in the process of ending that agreement with the city of St. Pete, the street outreach team. It's getting ready to be pulled to do a non-tethered model. So therefore, and one of the things I am pretty concerned about following the meeting that we just had is that now the PAC officers aren't going to have access. So it seems to me that that will impact this policy. In other words, we will be saying that, if I'm understanding you correctly, we will be saying that these individuals are in fact coming into contact with PAC officers. They are in fact getting services or resources. People are caring about these individuals, but we will not see that in HMIS. And because we're not seeing that in HMIS, they're going to go to we're taking you off the list. Am I understanding that correct?
Yeah.
So is that something we should be doing if this thing that is getting ready to happen?
I mean, I think that would happen whether it was 90 or 30 days, right? I think the issue that the COC will need to retake up is if police should not enter or see HMIS. That has been a policy the COC has had for some time. And that's the only way around it if there is not a street outreach person involved. I will tell you, it is not a common practice across the country to allow police access to your data that way.
We had sort of a similar conversation a couple board meetings ago with the churches and, people providing food. And we talked about providing that technology so they could touch HMIS, but this issue is going to be an issue because there's people at Missio Day or wherever that are not. We know, I think you said it, we have the homeless, we have the continuum of care in HMIS, and then we have this whole other system of care that doesn't operate necessarily within what we do for a variety of different reasons. So that's, I think, going to be a concern. Safety path, that's a larger issue, I think. But to move somebody because they haven't touched, it's not that they're not homeless. It's they haven't touched a program that enters into HMIS.
Which is a huge asterisk.
Which is probably
I think
more programs than not.
I do want to just kind of show this graphic really quick. Coordinated entry was a new idea a couple years ago when we implemented it. And we implemented it only up to group 3 in our community. One of the reasons we're spinning our wheels is because we need to go all the way down to group 1, which is right now what happens based on our policies is someone comes up, they get referred off the list. There's 10 days, I'm not going to quote the right number of days, you changed them recently, but they have 10 days to respond. We make all these contacts, they don't respond. They go back to the list. We do that. And so that happens 5, 6, 7 times. So now we've lost 70 days trying to get one person on the list. And so the way that other communities have evolved coordinated entry, now that we know more and what Built for Zero has recommended, is that there's two lists. There's the list of everybody that's in HMIS, that's the by name list. We need to know all those people. But the people who are getting called up for rapid rehousing, we have to know where they are. They have to have their documents ready. All of those things also impact system outcomes, which impacts our ability to be successful with HUD. There's no sense in us sending someone to a rapid rehousing provider when they don't have their documents yet and we can't find them. And so this is the reasoning for that shift is, changing coordinated entry based on what we know now that wasn't known when HUD first rolled out coordinated entry. And we right now do not have a prioritization list. We only have a connect list, and this helps us get to the prioritization list. I don't know if anybody's visual and that helps.
So Sam and I just want to check in on time. We have a half hour ago. We still have some pretty meaty items.
Yeah, so I'd say I hear those concerns. This policy came before data system performance. I think one of the caveats that we would love to see the CoC working on is other ways to connect with clients so that they can stay active. I think for the police workaround especially, I wonder if there would be a way that police focused outreach teams in our different areas could send a list of people they interact with to our HMIS team, who could then enter it as a touch with the date. So that law enforcement's not seeing any data, but that we'd have an opportunity to capture, at the very least, that person is still engaging with the homeless system and still exists and should stay on the list.
I appreciate those comments, and we're gonna have to follow back up on that. But let's say, we have this 30-day. The other question I had, and you said, to have a functional list and to move people. What problem are we solving for by going from 90 to 30? Like, what's that?
Just more likely to get a hold of, if they don't have a phone number, that means they've checked into a food bank or something in 30 days. Someone has seen them in 30 days. We could do 15 days, do you know what I mean? But it's just that 90 is way too drastic. And I wanted to mention really quick that the list has 1,300 people on it. When we implemented this policy in a pilot in our own systems, it only took off 300 people. It wasn't like 950 people went away and we were left with a small pool. There are people consistently, 1,000 of them checking in 30 days. So this wasn't a drastic point, as in it didn't kick a bunch of people out of CE. I know that makes me feel better.
But, to that point, there's a guy that I was trying to help, and I know, it's like historically, that he's homeless in and out hotel, but he managed to keep a job and support himself, but he can't get over the hump for how he works. At first watch, he makes $1,000 in 2 weeks or something. But it's like he'll show up at a shelter or but if he has to sign in or something, he'll just doesn't want to do it. He doesn't want to sign in for food. He doesn't want to. He comes to the church consistently to eat because I'm the cook. I know people. I've been doing this for 20 years. But I'm saying there are people who live particularly on the south side, and that's what I just cannot get you guys to understand. There's a lot of people who live in what they call abandoned houses, and those abandoned houses double as traps. So they're drug houses or places of prostitution and whatever, but that's where you got to stay, And so people are found dead for fentanyl. It's like found dead in the alleys and stuff like that of these bandits. And people just, they want to survive, but you can't talk to them. I'm one of the few people who can talk to them, okay, that have the credibility to I don't know, the dates, I don't know 90, I don't know 60, I don't know, whatever, but I know people just like to slide on the radio. And then if you present it to them, they don't understand it. I have about 2 or 3 people who don't understand, so such and such is gonna call you, so wait for that call. And I say, what happened? I say, the next week, what happened? Well, yeah, somebody called me, but I just couldn't, I didn't understand what he was talking about, you know, and so I had to maybe hold her hand, well, I don't know, but I know it's like, the lack of education, the lack, you know, it's like the historic, it's like a situation where people weren't on their side, okay? And so, and the racial prioritization, which wasn't it. Because, but for example, when I came here 20 years ago or whatever, it was very difficult for Black people to get a mental health diagnosis. Okay, you were either like a criminal, you were selling, you had a smart mouth, or you were criminal minded. You know, you weren't bipolar and all that. That was reserved for white people. You know, and so when it came to getting benefit from mental health, Black people couldn't get it. So I know we got to move.
Yeah.
Thank you, GW. Well, I mean, we're not gonna capture everybody. I think everybody's clear about that. But we have recommendations to change the coordinated entry policy, so I'll entertain a motion.
I'll move both these policies.
Sorry. Any further discussion? Seeing, hearing none, all in favor signify by saying aye.
Aye.
Any opposed signify by saying nay. Hearing none, motion passes unanimously, and I have all confidence that if this 30-day is not working, that we'll see it back in front of us, where we understand that this is a process and not an event, so we will continually improve based on conditions and capacity and all that good stuff. So thank you for your efforts in that. We're gonna rearrange the agenda real quick, just because we're running out of time. I'm gonna flip the NOFA debrief and timeline, which is also appointing the rank and review committee to make sure we get that done. And if we have time, we'll do the recommendations for DEI. If not, we'll move it to another board meeting.
I'll let Kaylee go over this. I have pulled it up. It is a draft agenda, so it could change. But we wanted to get this in front of you and let you know that it is that time of year again. And we are looking for a more robust rank and review committee than we've ever had before. Kaylee's really worked on changing the process so that those who sit on that committee have the opportunity to really learn more and understand what's expected of us from HUD. And then that may just be a learning process and capacity building. So you may join that and then say, oh, I don't have time, that date doesn't work. That's okay. We want as many people to understand I keep using acronyms, Peter, so please feel free to stop me. Notice of funding availability that will be forthcoming from HUD. So I'll turn it over to Kaylee.
And yeah, to make it even more
No
confusing, sometimes we call it the no-fuss, sometimes it's the no-go. Same thing. So yeah, this is on page 69 of your packets if you wanted to take a closer look. But as Amy said today, we're hoping to appoint some members to our rank and review committee. And further down in the timeline, you can see that there's 4 different meetings outlined for the rank and review committee. The first 3 are all different trainings. Those would be about an hour each. And then the final one, the 4th one, which takes place in September, would probably be about 2 hours, and that's where we would do those deliberations. So we're looking for people today that can volunteer about 5 hours of meeting time between now and September. And then also however long it's going to take you to review those applications. But we are making some changes this year to hopefully make it a lot easier and speedier to review those applications. And hopefully with the extra training, you know exactly what you're looking for. And so those reviews would hopefully not take you as long this year.
So we're planning to release the full RFP on May 16th. So that includes the actual application, the scoring matrix, all those things that anyone would need to apply. We're going to post those online and distribute them via email. And then the question period opens, a couple of regular review committee meetings in there. And then right now we have the RFP scheduled to be returned to us by July 8th. Then the Data and System Performance Committee will take a look at it, confirming some of the outcomes. We are not yet sure when HUD is going to release the NOCO, so we don't know for certain exactly what they're looking for, what kind of bonus projects they're going to be offering this year. But that can change any of this, so stay tuned for that. And then we're looking right now to have the applications provided to rank and review on July 29th and not back to us until August 29th. So you would have about a month to review those applications. So I think that's all the major highlights from the timeline, but if anybody has any questions.
I'll add for anybody who hasn't sat on rank and review before, maybe new to the COC. This is really, you get intimate knowledge about what we're funding, the projects, the outcomes. It has become easier and easier, I believe, over the years. And then when it first started, it's very data driven and performance based. And it's a critical component of what we do for the COC, or what we do as a COC. But it also will give you great insight into all that is happening with homeless services in Pinellas County and throughout our COC. So if you haven't sat on it before, we need members. We need new fresh eyes to look. And so I would strongly encourage your participation within rank and review. Duggan running that this year? And Duggan's running it this year.
Duggan always runs it as the chair of
He
funders.
does an amazing job.
We have Kathleen Beckman also volunteering to participate again this year. Thank you, Kathleen.
The only thing I note is that the July 22nd meeting coincides same time as a Funders Council standing meeting.
So push that up.
In each meeting, I'm assuming required attendance here, because that's what I'm looking at. Like there's one, like number 2, I'm not available. So that's why.
I mean, I think the advantage with Zoom is that we can always record meetings. It is required attendance the day, actual rank and review. But I think the other meetings leading up to that, we can record them, no problem.
If that's the case, I'm happy to participate if that's something.
Haley, I would like to volunteer a member of the Providers Council that may end up being me, but I would like to get it out to the Providers Council. I do think a provider should be on rank and review, so I don't know who that will be just yet.
So this is an official action this board has to take, so someone will need to make a motion with those names. And you could provide some flexibility that someone from providers and or other members are allowed to join if schedule conflicts arise, or so, we need some wiggle room in there because something always happens.
I believe I heard
I have April, Jennifer,
Duggan.
and
Okay.
And then Kaylee, neither Commissioner Flowers or Councilmember Big Sanders is here. I think one of them might be good as well.
Okay.
Both were involved last
Yeah, they both.
And I don't have any cancellations or substitute. July 23rd is my birthday, so I was planning on being in San Francisco, but I'll make a change if there's a need to. So I can do that in San Francisco.
yeah.
And then a provider.
I'm a non-provider.
I think it just, we need to make clear to providers that they're not, they can't apply.
Right.
When they, if they're on the committee, or if they are applying, don't be on the committee.
Okay, it is an action item, so we need, Kaylee, can you just read the list real quick?
April, Jennifer, Kathleen, Sam, Duggan, GW, Trenia if needed, and then Commissioner Flowers or Fix Sanders potentially.
And any other board member not present who may want to.
Unidentified member of the providers council.
Yeah. I'll entertain a motion.
I'll make that motion.
Second.
Okay, a motion is second, all in favor signify by saying aye.
Aye.
All opposed signify by saying nay. Hearing none, we will, our motion passes unanimously, sorry. We have about 15 minutes left.
I do need to just quickly mention, I won't go over every number, but you do have our debriefing document from HUD on how we scored on the COC application. I think it's important for all board members to know that. Thanks to Susan Finlon-Deso and the whole team who worked really hard on this application. We can add this to a conversation in prep for rank and review, but because there are funders here, I want to make sure that you review it. The types of things that we are getting pinged on, we have a really, really high score, but we are pinged on the fact that we have a high return to homelessness, that we don't have street outreach coverage in our entire community. We were actually pinged on our rank and review process, which is why we are changing it a little bit this year. And we're going to ask you to make really hard decisions that no rank and review likes to make, but we lost some significant points in that area. So we'll be changing the process for that. So there's some other areas, but I really wanted to point out some of those things that we need to focus on moving forward. And that's why they were provided to you so that you know where we've got to increase our score in future years. Last year, we were awarded regardless of score. We do not believe that is what will happen with HUD this year. So we need to be as competitive as possible.
All right, we're gonna go ahead and move the DEI discussion to another board meeting because I want to make sure there's enough time for them to fully go over it and for us to have a discussion on it. We'll move on, and I also want to make sure there's time for announcement of public comments. Quickly, board seat committee assignments applications.
Yes, so we kind of let committee assignments be a rough process during COVID, but we were trying to get everybody back on track. So Bria and I've worked on the committee assignment list. She is reaching out to folks to let you know your assignment or to check that that schedule works with you. So you'll be hearing from her shortly. Our application period is opening. I gotta find that in, I know we had a document with this one, but maybe it got left out. We will email that out after this meeting, but we have a couple people who can renew and we'll have a couple of seats that will be opening. So we want to get that started so that we are ready for the November membership meeting. I will see if I can find that and get it out to you.
I would just say about the committees, this board is not an easy board to kind of wrap your head around, but you don't have to be, an expert on everything we do here. The real work happens in the committees. So look at a committee you may be interested in, whether that's Funders Council or data system performance, whatever it may be that may interest you. And that's where the real work gets done. And then we come and kind of vet that from here. So please get on it. If you're not on a committee, look at the committee and really sink your teeth into that work. Because we need that expertise at the committee level. They should be vetting everything that's happening at the board level. What you see here is funders and providers and the DEI committee. Everything has gone through and been vetted by board members and CoC members prior to getting up to the board vote. So
Okay, I have the dates. So application renewals will be needed by June 17th. The executive committee will review those renewals on August 15th. New applications will be due by August 19th. And then the governance committee will review those on September 19th. Here are the seats that are up for renewal. And again, we'll send this out. Sean King is up. He can serve another term. He has let the executive committee know already that he would like to stay on the board, but does not want to continue as chair. Sam, you actually renewed last year, so you should be good. I think I'll have to double check these because I feel like we edited them, but Duggan, I think may be up for renewal. But both funders and providers don't actually, they appoint their members. So their council just has to reappoint it. We have Stacy from Baycare. We still need a healthcare seat, so we hope Stacy will continue. Chris Kovac from our business seat will need to be looked at. And then Ashley Lowry is a service expert, so providers could appoint her again. And GW's term as formerly homeless is up, so we'll need to look at that one as well. But we'll get all of this out to everybody.
Want to talk about the membership kickoff, May 25th? Mark your calendar.
So May 25th, you know, we had switched back to only having membership meetings once a year. That's not in compliance with that, so we're trying to get back on track. We will have our first kickoff meeting in May. We hope that you will help get policymakers and those who can make a difference there, as well as people who may want to become new members. We're planning on doing something a little bit different this time. We think that the numbers are important. We will present a state of the state, but we want to then follow that up with stories and faces, people who are actually experiencing homelessness, so that people can put a face to the problem. And we also want everyone to understand what case managers go through every day. And so we are planning on a day in the life of case manager kind of presentation, as well as, you know, kicking off membership renewal and all of those great things. There are flyers in the back. So we do want to remind you that membership meetings are required in order for you to vote in November. So please prioritize attendance. And that is all on that.
May 25th, 5:30, Allendale. Okay, I'm gonna open it up for public comment. I'm gonna go to the Zoom first, and then we'll see if we have any in the house. Do we have anybody, public or board member, that has anything they want to share with the CoC on the Zoom?
And while Zoom is preparing, we do need every board member to re-sign. Annually, you need to sign your conflict of interest statement. If you didn't bring it today, there's blank ones in the back, and we need you to sign it before you leave.
Okay, well, seeing or hearing none from Zoom, do we have any public comment from board or the public in the room? Yes, sir.
Yes, I just wanted to state that I'm hoping in the future that with the Alliance, and I don't understand my role completely as I'm scratching the surface with a lot of different organizations coming together, that we do try to get a homeless shelter in Tarpon Springs and in North Pinellas County to help balance out all the other homeless shelters in need, so we can do our part as well, because the Shelter Center does a great job in our food bank and feeding those in need. And I just want to make sure that, you know, this Alliance does look out for Tarpon Springs as well, and that's my duty. So thank you all.
I just have one observation. I'm not sure if you can address it here, but just be aware that there are a number of bus stops that have become daily shelters, particularly on 4th Street South. And regular customers have not been able to access those seatings because of it. So I don't know, if something the chief probably might need to take a look at, but just be aware, that's where a lot of people are going in this interim. And again, reaching out to the new provider that's replaced Epic to make sure that they are part of this body, having that conversation. Because I think it's important that people know that we're about helping and not about hindering families, about taking children away. If we can make that kind of guarantee, if we can, fine. If not, we can expect more of the same. That's a concern. And that everyone in their position and power of influence to make sure we increase our housing stock for those that are making $1,000 to $2,000 a month, that will never get to the point where they're sustainable, that they can get housing in this city. So we need everybody's effort and prayers and influence to make sure those kind of shelters are made available, or units are made available, including hotels, because many times that's the only place they can go. So, thank you.
I would add that, or I would say, if those that are provide services, I would pay attention to the City St. Pete ARPA dollars. They're looking at doing like guaranteed minimum income for youth aging out of foster care pilot program. There's the non-congregate shelter dollars that are coming down. There's about to be a $20 million RFP for, I believe, multifamily housing units and a couple other programs. They're looking at doing like social services hubs in targeted neighborhoods. So if that's not on your radar and you provide services in St. Pete, I think those discussions, the administration just put out their kind of wish list, and now council is vetting that. So just keep that on your radar. If there's 30+ million in funding. Yes, sir.
I would just like to close by saying there is a real need for people who can prevent people from falling through the cracks, because there's a lot of people, and you know, that creates crime, it creates broken families. There are just a lot of people who don't match up, and they need navigators that are urban navigators, that are navigators that know where they're coming from. And so I've said for years that just when we do the count, for example, when we gather people for shelters, we're not really looking at the total population when we do that, the total vulnerable homeless population. You know, when we do the count, you know, it's like if somebody just goes, well, there's a bad neighborhood, and so I'm just going to guess and count over there. You know, it's like we're not getting an accurate portrayal of what's really going on and who profits and who bleeds in the city.
Thank you. Sorry, thank you.
I don't want to take a bunch of time, but just something that April and Ms. Cox was saying, made me think. Do the social workers that are contracted through St. Pete PD, do they enter into HMS at all? Was that discussed on Wednesday?
So the street outreach team, this, my staff,
Yeah.
attached to that team enters into HMIS. The PATH team does not.
And
The call team does not.
The call team does not.
Was that discussed Wednesday?
The call team was not discussed on Wednesday.
I did try to get that in their contract, when it came up for renew, and was unsuccessful in that. And our council member that could do that now is not here, but I'll be sure to put that bug in her ear.
And with it being 11:29, we'll adjourn the meeting. Thank you, everybody. Go shop.